Health experts say that Americans should not be afraid to travel right now because of global disease outbreaks. Doctors say Missourians' risk of contracting hantavirus or Ebola is currently low. Hannah Falcon spoke with the experts about where and when to take precautions.
Whether by air, sea, or land, millions of Americans are planning to travel this summer, and news of hantavirus and Ebola outbreaks globally are not stopping them.
It is a very busy season.
Missouri-based travel agent and seasoned explorer Bethany Bird says the airports are still packed and people are not canceling trips.
I haven't had a whole lot of questions about it. I mean, I was just in the Netherlands where it originated. And nobody really seems to be questioning it.
The Centers for Disease Control currently has the Democratic Republic of Congo at level 3 travel advisory after the World Health Organization declared a public health emergency there for an Ebola outbreak. In addition, the CDC is testing for possible Andes hantavirus cases. 10 have been reported worldwide.
I think the risk to Missourians at present is quite low.
Infectious disease Dr. Taylor Nelson is not worried. She says as long as you follow normal health protocols, you should be safe.
I would recommend, if you've traveled and you come back and you're not feeling well, it's better to be safe than sorry and contact your doctor.
Some things to pack while you're traveling: hand sanitizer that's at least 60% alcohol, a mask, and some disinfectant wipes. You can find a full list on the CDC's website specific to the area you're traveling and the mode of transportation.
If you don't feel comfortable traveling, then don't, because it's going to always be in the back of your mind and you're going to be hypersensitive to it.
For Missourians staying home this summer, the same recommendations apply, especially in the Kansas City area, where international travelers are expected for the FIFA World Cup. Reporting in Jefferson City, I'm Hannah Falcon.